Hi guys, this is Ali from Medicine Made Easy. How you doing? Thank you for um, checking my YouTube channel. Today, there is an important subject we always getting asked about, and we always have to use it in our clinical rotation. Is the local anesthesia maximum dose calculation? We have multiple local anesthetics to use, especially if you need to drain an abscess or to suture an incision. And mostly we have the lidocaine, which is the xylocaine, and the bupivacaine, which is the marcaine. And we will talk about both of these in this PowerPoint. So why we need to know the maximum dose? Because of the risk of toxicity of this local anesthesia. And as you know, toxicity of local anesthesia will lead to cardiotoxicity and neurotoxicity. So put in your mind, side effects might happen, especially cardiovascular and neurology side effects. Let's start with the 1% plain lidocaine, which is xylocaine or lidocaine without epinephrine. The maximum dose of lidocaine without epinephrine is 5 milligram per kilogram. So we have 1% as an example here in this PowerPoint slide. So if we have a 70 kilogram adult, we can inject up to 350 milligram of a plain 1% lidocaine. Because, as we said, 5 milligram per kilogram, 70 kilogram, that means 350. But how can we know how much we give as a ml, a cc, cubic centimeters or milliliters? Actually, because it's 1% lidocaine, 1%, that means every 1 ml give you a 10 milligram. Of course, if you give 2%, that means every 1 ml give you 20 milligram. So let's stick to the 1%, and you can change when you have a different percentage. So as we said, we can inject up to 350 milligram of a plain 1% lidocaine. That means 35 ml, because every ml give, as we said, 10 milligram. What about the lidocaine with epinephrine? As we know, adding epinephrine has a lot of good effects. One of them is like we can inject more volume, and actually and also has a quicker effect. And also we're going to reduce the risk of bleeding. There will be advantage of hemostasis. So there are three advantages: a quicker action, lasts for longer time, and also again we can inject more volume, and also the hemostasis. So there are four advantages of using epinephrine with lidocaine. But as you know, there are some actually contraindications for the use of epinephrine in the end arteries, which means like if you are injecting in the nose or in the ear or in the fingers or in the penis. So it's not actually good to add epinephrine to the local anesthesia, because it might end with gangrene, necrosis and gangrene, because of the vasoconstriction. So the maximum dose of 1% lidocaine with epinephrine is 7 milligram per kilogram. So again, if we calculate for a 70 kilogram adult, we can give up to 490 milligram, which is 49 ml of lidocaine with epinephrine. What about the bupivacaine, which is the marcaine? Also, bupivacaine comes with either 0.25%, which is a quarter percent, or 0.5, which is half percent. Let's use the 0.5% as an example, and definitely the 0.25% will give less concentration per ml. So definitely we can give more volume of the 0.25% than the 0.5, definitely half the volume. The 0.5%, we can give half the volume of the 0.25%. Yes, so let's come to the calculation of the bupivacaine, which is a marketing. The maximum dose of bupivacaine without epinephrine. So let's start with the plain, just like what we start with the lidocaine, the plain one. So without epinephrine is 2 milligram per kilogram. Maybe guys, you look at some resources that says 2.5 milligram per kilogram. I choose to put 2 just to be on the safe side, but you can actually, it's between 2 and 2.5 milligram per kilogram. And so far, for a 70 kilogram adult, 70 kilogram, if we give 2 milligram per kilogram as a maximum dose, for 70 kilogram adult, we can give up to 140 milligram. So 140 milligram, that means how many ml? Because every ml will give 5 milligram. The 0.5% marcaine or bupivacaine, every 1 ml will give 5 milligram. So 28 ml. 28 ml times 5 is 140. So 28 ml of 1% of 0.5% bupivacaine without epinephrine is the maximum dose we can give to a 70 kilogram adult. And you can change the calculation definitely depending on the weight of the patient in kilograms, and also the percentage of the local anesthesia. Like if you give, for example, as we said before, if we give a 0.25%, that means we can give double the amount of the 0.5% bupivacaine, because definitely 1 ml of 0.25% will give only 2.5 milligram per ml. So if we need to give 140 milligram, that means we can give 56 ml of the 0.25% bupivacaine to a 70 kilogram adult. Okay, I don't want to confuse you guys, but I'm trying to make it as easy as possible. Thank you so much. And let's come to the bupivacaine with epinephrine. Definitely, when we add epinephrine, the same advantages that when we add it to the lidocaine is that we can inject more volume, and also hemostasis, quicker action, and longer duration of action. So the maximum dose of bupivacaine with epinephrine is 3 milligram per kilogram. So this is one of the advantages that we can give more volume. So 3 milligram per kilogram. So we can inject up to 210 milligram of bupivacaine to a 70 kilogram adult, because 70 times 3 is 210. So how many ml? 42 ml. Why? Because we said every 1 ml of 0.5% bupivacaine give 5 milligram. So 42 times 5 is 210. So 42 ml of 0.5% bupivacaine with epinephrine is the maximum dose we can give to a 70 kilogram adult person. I hope guys you enjoy my YouTube about local anesthesia. Thank you for subscription and supporting my channel. If you have any comment, any question, if there is any mistake in the PowerPoint slide or my YouTubes, please let me know in the comment section. Thanks a lot. Thank you for watching. Good luck in your career, in your study, in your exam. Keep in touch. Bye now.